Hello, my name is Vijay Letchuman, and I'm a neurosurgery resident at the University of California, San Francisco. Today, we will be discussing our manuscript, Racial Differences in Postoperative Opioid Prescribing Practices in Spine Surgical Patients. I'd like to first of all thank my mentors, Dr. Praveen Mummaneni and Dr. Guan of the UCSF Neurosurgery and Anesthesia departments for their assistance and guidance with this study. As the opioid epidemic accelerates in the United States, various sociodemographic factors have been implicated in its development. Recent studies have suggested potential associations between race and postoperative pain management requirements. Thus, we aim to characterize perioperative opioid requirements across races following spine surgery. Our cohort consisted of 1,944 opioid-naive spine surgical patients across a span of 7 years. We defined opioid-naive patients as those without any active opioid prescription in the 6 months prior to their admission. For our analysis, we focused on patients who self-identified as white, black, or Asian. Our primary outcome measures were inpatient and outpatient opioid dose measured in morphine milligram equivalents, along with outpatient opioid refill rates. The postoperative characteristics determined by case length, postoperative length of stay, and reoperation rates were similar between races in our cohort. When examining opioid use, white patients received more opioids in the inpatient setting compared to Asian patients. This was seen again in the outpatient setting, with white patients receiving higher daily doses of opioids and longer durations of opioid prescriptions. Finally, often used as a measure of healthcare quality, 30-day readmission rates were lower for white patients. However, by 90 days, there was no difference in readmission rates. In a large cohort of opioid-naive postoperative neurosurgical patients, this study demonstrates higher inpatient and outpatient opioid usage among white patients. Increasing physician awareness to the effect of race on inpatient and outpatient pain management requirements would allow for a modified opioid prescribing practice that ensures effective yet limited opioid dosages void of implicit biases. Thank you for listening, and I would once again like to thank Dr. Praveen Mummaneni and Dr. Guan of the UCSF Neurosurgery and Anesthesia departments for their help and guidance with this project. Thank you.